Hello, everybody. I'm really happy to be one of the speakers on this international conference on apitherapy for children. It is a very important conference. It is about the future of our world on this planet. So my topic will be on guidelines, rules, and principles on how to use the bee products for children. And let me share the screen and increase here the size, and I'll just start the presentation. So first of all, some images to enter into the atmosphere related to the children. We know that children are very, very soft beings. They have a huge potential, but they are very soft, and they must be protected and very well nourished and have a good blood flow and hydration and many conditions, including relaxation. And if we can succeed in providing all these things, then we can really love our children and really protect them and make them healthy. So a few apitherapy principles. See, we use all bee products in apitherapy, including for children. We can use even bee venom highly diluted in homeopathical form or in cream form. But also, of course, the honey, the propolis, and all the other ones are easy to be used in apitherapy for children, including beehive air. So which are these rules? First rule is primam nihil nocere. It's a principle from Hippocrates, which said, do not experiment on your patient. Use only safe methods and high quality products. And although the classical modern medicine, it's very advanced now, there are still a lot of adverse reactions, a lot of problems in the interaction between the drugs, or the treatment is not well done, and so on and so on. And you see here in this slide, novel drug, chemical-based drug, needs a lot of money and a lot of time when it is done correctly. But despite this correct research, about 95% of the human studies on this new drug are giving failures. So we must be very cautious when we use chemical-based drugs for our children. And unless it's really mandatory, unless it's an expert in pediatry which says it is a must, then we should agree with these ones. Another principle is the diagnostic of a disease, not only in old or adult patients, but also in children. The diagnosis should be at all levels, at physical level, energetical level, functional level, psycho-emotional level. And for this kind of diagnosis, the best medicines are the Chinese medicine, Ayurvedic medicine, homeopathy, and the psychodiagnosis. So do not stay only on physical diagnosis, for example, acne or asthma or bronchitis. This is just a very superficial diagnosis. You need to go to find the causes of the causes for that disease in your child. And only then, when you have the list of all causes of the causes, then you can start to think to the treatment protocol. So first, do no harm. Identify and treat the causes. Use the healing power of nature. The doctor is your teacher. Treat always the whole person, not only a part of it. So you cannot give to a child only a pill or a capsule or a suppository. You need to treat all parts of the child, all cells, tissues, and organs, with diet and with all other methods, including apitherapy. And of course, the most intelligent part is the prevention. There is a saying, an intelligent doctor or an intelligent therapist is preventing diseases, and the one who is not so intelligent is treating the disease. Now, before starting any treatment, or including on a child, in many cases, especially in obese children with a bad diet, we need to do the cleansing of the body, external, internal, at all levels. This is an important issue also for the adults and old people, but also for the children. because if they may have constipation, or they may have some kidney problems or lung problems or skin problems, so they cannot eliminate easily the toxins from their body. Although they have usually a clean body in comparison with the adults, they still have some residues, of course, from all the cells in their body. Now, we know, everybody know, but let's point it here too, the fresh organic bee products of medicinal quality, ideally, which means very, very clean product and as monofloral as possible to be able to treat mono diseases. So this is okay, the raw honey, the organic medicinal honey. But the processed honeys, in this case, has usually little or no pollen, all enzymes or antioxidants are lost. Usually this honey is filtered and pasteurized, so it loses some of the enzymes. May cause health issues in long run because it's usually loaded with sugar or other monocarbohydrates which are not beneficial for the health. So go for organic honey, raw honey, unheated honey for your children. Now, of course, you need to select attentively the bee products according to their origin, composition, and pharmacological properties mainly. There are over 100 pharmacological properties in the bee products. So depending on the disease of your child, you need to select that bee product, that extract of the bee product, that form of administration, which is covering ideally the needs of the child. The quality of the bee products and their methods of storage are also, of course, very important. Usually, although many people say that honey can be kept at room temperature, it is a study done in Bulgaria many years ago. If you keep the honey in a refrigerator, it will stay longer unchanged. Freezer can be used also for the storage for products like Capillar Nil or Royal Jelly. And of course, before we start the treatment with any bee product, including bee pollen, bee bread, royal jelly, honey, and so on and so on, you need to start with an allergy test, especially if the child has other allergies, like allergy to dust or insects or anything else. They may be prone to allergy also to bee products. So you need to speak with a good allergist. And this one can do an anamnesis, can speak with the family, and then may do some kind of test like this ones. Now, gradually increase the dose of the bee product, especially to the children. So you start with a very low dose, you make the allergy test or the tolerance test first, then you increase very gradually until you reach that healing dose, or that dose which eliminates the symptom to the child when the child starts to be happy again. And then you stay on this healing dose until the specialist, like the pediatrician in this situation for the children, says, yeah, now your child is healed, so now you can go to diminish the dose. But as you see in this graphic, and this is the beauty of the bee products, you can stay on a prevention dose. In the case of chemical drugs, you usually go to 0. But in the case of the bee products, we can continue with the bee products because they are also food. They are so-called nutraceuticals. They are used as ceuticals, as healing remedies, like in this phase, this area, like from here to here. But then they can continue to be used as foods. And they're, of course, very good foods which can prevent many diseases. And of course, the final dose of each bee products must be established with accuracy according to the age, the weight, general local condition of each child, time of application, etc., etc. And here is some vehicles. So it's not a good idea to use only the oral administration. Like if you use, for example, a certain bee products like honey, only orally through the mouth, and the child has asthma or bronchitis, you lose a possibility to heal faster. That's why it's good to use also nebulizers, like you see here in this image, or you can use also suppositories with propolis, or creams with propolis, or honey, which you can apply on the body of the child, of course, diluted at the beginning, and then you can start slowly to help the healing. In homeopathy, we have this important principle, similia similibus curantur, which means that we can use small doses of the bee products to treat allergies of the same bee products. For example, in case of a pollen allergy, we can use extremely small doses, like 1 grain of or 1 pellet of pollen, diluted in, let's say, 1 liter of water, and added some honey, and then from this one, the child takes a few milliliter first day, then you increase gradually the dose. Okay? Now, the time of treatment, this is a bit specific thing, but we know that we have those biorhythms of our body, the circadian rhythms or monthly rhythms, and the child, of course, have also same kind of rhythms. So you can respect this kind of rules, like in the morning is more cortisol secreted. So this is the best time to use some methods which need maybe a bit of force or a bit of intensity. Apitherapy, let's say it very clearly, is not a panacea, cannot heal everything. And good therapist is using several healing methods, including phytotherapy, which means medicinal plants, aromatherapy, which means essential oils or volatile oils, acupuncture, organic diet, Ayurveda, and so on. So this is a message to all of you, people who are seeing this video. Learn as many as possible healing methods. Do not stay on only 1 or 2 healing methods. Learn as many as possible other healing methods, because every patient reacts better to a certain method. There are people who react very, very good to aromatherapy, but other people, they react to acupressure, for example, like you see in this image. So if you are doing only aromatherapy, but you do not do foot reflex therapy, you lose the chance to heal your child or your patient quickly. Another very, very important principle in the healing is to improve the blood flow, because with a good blood flow, everything is possible in the body, detox, nourishment, oxygen bringing, regeneration, and so on and so on. So there are many methods to improve the blood flow, like you see here in this slide. Then good sleep and relaxation enhances the effect of our bee products. So if you want a fast healing, you must ensure that the child sleeps well. And there are many methods to help the child to sleep well. So ask the pediatrician, the psychologist, or any other specialist in this issue to help you. Good environment, of course, clean, order, non-polluted are beneficial too. So if you really live in a city where it's a lot of pollution, so you cannot change your house, your apartment, and so on, try to have a very clean apartment, and then use inside those filters, including pollen, which propolizers, which are propolizing the air in the room, which are cleaning the room as best as possible. Then a positive thinking family friends group is also beneficial. We know that people with optimistic thinking, they heal faster. So the children need to be surrounded by optimistic people, not by depressed people. If you are depressed as a father or mother, go to a psychotherapist, find the causes of your depression, and then come back to your child. Until you solve your depression, maybe the child should go to the grandparents. Individualize your treatment. Each child is unique and must receive a unique treatment. So forget about this idea that 100 children with asthma should receive the same treatment like in classical allopathic medicine. This is a huge mistake, because each child is unique and reacts uniquely to the treatment and needs a unique treatment. Now, here is another issue, another kind of a conclusion. If you look to all the bee products, the composition of the bee products, they contain thousands of molecules, like you see here around. And if you make a scientific research on the effect of flavonoids or the polyphenols, you'll find really, just go to PubMed, thousands of studies on polyphenols. And there are so many beneficial effects only on polyphenols, but there are many other things here in these bee products. So if you make a good treatment, a correct treatment, you will always have good results in the children. Extremely seldom you'll not have good results in children. But also be aware that apitherapy is not a blitz method, like you heal the child in 1 hour or 1 day. You need perseverance and patience, especially in chronic diseases, because in the chronic diseases, you need time for the cells to regenerate, for the tissues to regenerate. And this takes time. And you see here in this graph, we have this here the time, maybe hours needed a treatment for very short, not complicated problems, but sometimes maybe needed days or weeks or months or even years. You need to be patient in order to heal your child. And of course, you need to invest a lot in the education of the patients, because the patient must understand why he is ill. Even if he's a child, he must understand that he made a mistake with the diet, that he ate too many bonbons, he stayed too much on the tablets, and so on and so on. And this must be stressed. Now, for the therapists, in our case now as apitherapists, we must know very, very, very many details on the bee life, because if we understand very well the bees, we can understand better the bee products and how to use them. Here is another interesting issue. You in the position of therapist, you must be yourself, first of all, healed, healthy. If you are having diseases, various diseases or only one disease, no matter, if you have a disease, you cannot treat somebody which has also diseases. So do the best you can to keep under control your weaknesses, to get rid of your possible diseases. And if this is needed to take some time, some free time, do it. And then when you are completely healed, start to heal other people. Okay, now, of course, here is an education-related thing. We need to exchange information between all of our networks. We have, I would say, about 100,000 apitherapy practitioners in the world, at least. And of course, each apitherapist has its own experience. But like we have our WhatsApp groups, email groups, and we organize many conferences like this one. We can have a very good experience exchange, and this is beneficial for our patients. Now let's see some nice images with the children, which will be our future, and with the future children, which will be future apitherapists. Education, education, education. Yes. So see very nice photos. This is just to tonify you, to tell you that there is a lot of hope for the future of apitherapy in this world. And if you have a child, try to make him close to the bee products, but not to the smoke, to the smoker. We know that the smoke is very bad, and it goes also into the honey. So there are now modern ecological smokers, so-called smokers, which are not using the real smoke, but just essential oils. Okay. So try to enter into the mind of a child which is fascinated by the bees. Love, protect them, teach them, heal them, like you see here in near Barcelona, this behavior therapy system by Samuel Ramal. Here in Germany, here somewhere in one building in New York, you see the Chrysler building. So there is a lot of rooftop beekeeping in the world. Here is a child keeping a child swarm in his hand. Here a child tasting honey. By the way, it's good to give to the child many different types of honey to test which kind of honey is the best for this child for this disease. Okay. And here it's a photo of a young girl from Switzerland. I saw her last year. She was taking fresh pollen directly from the pollen trap since she was like 6-8 months old. And she was so fascinated, so happy with the pollen. She was smiling with big mouth each time when she was taking the pollen. And I'm coming close to the finish of my presentation. And I thank you for your attention. And if you want to be trained in apitherapy, including for children, feel free to contact us through our website. Thank you very much. Thank you very much for your attention again. And see you soon to other conferences, like we have in Romania in May, 24 to 27 of May. We have in Germany also next month in 22 to 25 of March. And it will come many other conferences, including in Australia and many other countries. Thank you and be healthy.